So put a smile on that face and get ready for today, Tuesday. As we said earlier, Dr. Ford is here, ever present. You have been so faithful for the last couple years, and we truly appreciate your contribution, Dr. Ford. Good morning.
Thank you. Good morning. Season's greetings to you,
Thank
Cassandra,
you.
Doug, and to the viewers as well.
Yes.
Well, thank you, Dr. Ford. I want to tell you that in conversation with a lot of our viewers, they say you bring a certain amount of freshness to the program in that you discuss conditions that they never thought about, but that a lot of them suffer.
Ah.
They say, I see these things.
Didn't know it had a name.
I didn't know what this was. I just thought it was just like a little clear spot, or those kinds of things. And I think that is important as we continue to educate Barbados. And this morning, you want to focus on something that's near and dear to me, because my nickname going to high school was Moley Mo.
You never told me
I
that.
had a huge mole here, the residue of which is still here. I had a huge mole, and the first opportunity I got to remove it, I did.
Okay.
So tell us, what are moles and why do they come about in the first place?
Well, there are many things that Barbadians call moles, but what dermatologists call moles are structures called melanocytic nevi.
Okay.
And they represent structures on the skin where the pigment cells are collected together. So we're not talking about the moles on the face, the little papules or bumps on the face that are so common among Barbadians and in the Caribbean region. We're really talking about structures that are individual, and someone can have maybe 20 of them or so on average, but there's some who have more. They have names based on where the pigment cells are, but for us, we know moles because they're pigmented structures. Usually they're flat and they're called junctional nevi. That's where the pigment is between the two upper layers, the epidermis and the dermis. But the moles that we know best are the moles that are colored and appear as a little bump and sometimes have hair growing out of them.
Right.
Now in that case, the pigment is in two layers. It's at the junction and it's also in the lower layer called the dermis. And you can also have similar moles that are skin colored and have hair growing out of them that are on the body. So sometimes you can be born with a mole, and that one is called a congenital mole. Usually it comes at birth, you have it, or within the first 2 years, and they tend to be a lot bigger. They can be around 2 centimeters, or they can be in excess of 15 centimeters, depending on how large it can be, and with time they can get very hairy.
Right.
So pigmented structures on the body are called moles.
Okay. How easy is it to fix them? Like, I know a few people who have had them removed. Can we expect it to be a permanent situation?
Well, most moles are harmless, and there's no need to do anything about them. You need to have a reason to remove a mole. Either cosmetically, the mole is not very desirable, or people are drawn to it, like
Right.
Doug's mole on the
Moley Mo.
on the chin that gave him a nickname.
Yeah.
Or sometimes a mole can be a nuisance mole, where let's say you have a mole on your shoulder and your seatbelt keeps rubbing on it, or it's in a place where an article of clothing, let's say your pants, or for a woman a bra, gets in the way. You may want to remove it. But the main reason we may remove a mole would be because of a suspicion of it not being a good mole.
Right.
And that's the mole that you may call a dysplastic mole, or that anything that has color, sometimes we worry about the condition called melanoma, which we only dealt with melanomas of the hands and the feet that affect the darker skin, but we haven't yet talked about melanoma in the rest of the population.
But how would you determine that a mole is a troublesome mole?
Well, this is where a lot of expertise and experience comes in, because for moles there are certain characteristics that tell us that the mole is harmless. And usually a mole that's harmless is symmetrical. And when we talk about symmetry, we're talking about the ability to draw a line through the mole and almost fold it on itself, or one side being the same as the other.
Oh.
So if a mole is not symmetrical, then we worry about it. Also, the borders should be very well demarcated. And if you have a border that's undulating or fading away or looking kind of strange, that's another sign. The color should be uniform, but when the color is variable, let's say brown and black and lots of unusual disorderly appearances, then we get worried. But the diameter should be around the size of a pencil eraser, and the E is for evolution, which means that the mole is changing. So anytime a mole changes, or it starts to bleed, or it starts to itch, any change in a mole or in its appearance, then that's a mole that may
That's a
not be a
problem.
mole, and that's when we think about melanoma.
Okay.
So the important thing is to be aware of what's on your body and how it's changing.
Well, having said that, generally, the dark things people have is what we call moles. Some of them are flatter, and some of them kind of raise off of the skin. If one of those comes off on its own, what happens? Do they bleed? And what should you do? How should you deal with it?
Well, a mole has a blood supply, but it's so small that if it does come off and it starts to bleed, just pressure on it for a few minutes will stop the bleeding, unless you have a bleeding
big
disorder.
Oh,
But even if you have a big one, pressure will apply to it, will
Really?
stop it, and there's no real need to be worried. It's unlikely that a mole could cause your demise.
yeah.
But I know
From
that there's
bleeding, I
some
mean.
moles that grow. I've known people who had them on their face, and they kept, spiraling out, and and they would squeeze and and turn them
Oh.
and turn them until after a while
Twist
they
it
just fell
off.
Yeah.
Yeah, that's what the Barbadian calls the mole, but we call it dermatosis papulosa nigra. We had done a program on that earlier. That's really a thickening of the cells in the basement membrane of the epidermis, something called a squamous papilloma. But in actual fact, they are different structures, but they have a color, and that's why we call them moles, because they have a similar appearance.
Okay.
And indeed, there are other structures on the skin that have a proliferation of normal cells, and they're given names based on that. But what's on the face that we see commonly, even though we call it moles, they're not melanocytic nevi, the type that we're talking about, where you just have one papule and hair growing out of it and that sort of thing.
Right. So if you see one of these with the hair follicle growing out of it, should you leave it? Should you go tugging at the hair? Should you go trying to extract whatever's in there? Because people do that as well.
Yes, people love to squeeze things. That's
Yeah,
one
yeah,
of
yeah.
one of our obsessions, is squeezing everything we can get our hands on. But for where hair is concerned, you can either clip the hair, or you can have the hair, you can have laser treatment applied to the hair if it's troublesome. But usually just clipping it is enough to stop the hair growing out. Or if you really love it, then you can leave the hair sticking out. But hair is usually a big part of of the congenital nevi, these bigger ones that get really, really hairy. And we saw another one a few programs ago called the Becker's nevus that also grows lots of hair.
Yeah.
Okay. Well, what about skin tags? What people call skin tags. How do you manage those?
Well, again, skin tags, you can just admire them and do nothing if they don't bother you, or you can decide to have them removed. It's a very simple procedure to have done in the office. They can be done, if they're small, by cryotherapy or freezing. Or if they're larger, then we just clip the neck of them and we just burn it off, or we can excise the stalk of it. Just last week I had a patient who had a skin tag that was about 4 centimeters by 3
Right.
centimeters, and he decided to tie some horsehair on it. And it was causing a great deal of discomfort and pain, because when you tie a hair around the stalk of one of these things, you cut off the blood supply, and it has a very slow, unfortunate death.
Oh dear.
So tying horsehair on structures on the skin is never a good idea unless you're willing to put up with the pain that's involved, because it will take over a week for that to fall off.
Oh, wow.
So
So we
there's
wouldn't
some truth
recommend
in the horsehair.
we wouldn't recommend
Would you
doing
have-
that.
But
I've
they don't
always heard
recommend it.
But I've
Yeah.
always heard about using horsehair to remove a mole.
Yeah,
I
but
didn't know
it's-
there was any truth in it.
It's not a good thing. It's like if you tied a string to your finger and waited for the finger to die or something like that. It's just
Okay.
not a logical thing to do.
What there are people who have moles all about their body, under their arms, as you talked about, the shoulder, their genitals, and so on. I mean, how do you manage these things?
Are they-
Well, the important thing is monitoring. You can take, with the age of cell phones, you can take photographs of your moles and keep track of them in that way. Now there's also something called mole mapping, where you can go into the doctor and you get these special photographs taken, and the ones that are of significance we pay closer attention to. But the important thing is for you to have your skin looked at often, and there is a condition called dysplastic mole syndrome, or familial atypical mole melanoma syndrome, where an individual has between 50 to 100 moles, and they have these moles that are very disturbing in appearance. They look irregular, the shapes are different, the color is different, And those individuals end up getting lots of excisions to have the moles tested. And most of the results say that these moles are what are called dysplastic. So these individuals are more prone to melanoma, and also with time and also with sunlight. You know that having lots of sun on your body can make you get acquired nevi, because we talked about moles that you can get from birth or by 2 years of age, but someone who acquires moles can be someone who spent a lot of time in the sun. And there's a correlation between too much sun and having bad skin conditions, including melanoma. So the important thing is to be aware of it if you have lots of moles, and especially if you have a relative who has a history of melanoma, you should have your skin checked, because you may have a genetic predisposition for getting a melanoma.
Okay, good advice as always on how to handle let's say the scientific way, Doc.
Melanocytic nevi.
Yeah, it's best you say that,
Yeah.
or moles. And don't tie any horsehair around anything, skin tag, moles, whatever. You know, just take the advice, go see your dermatologist and get the best advice. And as you know, since we've been seeing you so often during the last couple of years, and you've been so faithful in helping us, we thought we'd give you a little something. Gentlemen only.
Wow.
Givenchy. This
Thank
is
you.
from
So appropriate.
My Cave Shepherd. Exactly. Our thoughts. Exactly. This is from My Cave Shepherd, one of our partners, helping us to gift some items to those who have been good to Morning Barbados through the years. So we want to say
Thank you very much. I think I have to give you a special kiss, but not Doug.
Oh.
Hey.
Thank you, Dr. Ford, and thank you so much for your contributions.
You're welcome.
Don't feel bad.
Thank you, Dr. Ford. I appreciate it.
All right.
All the best.
Merry Christmas. Merry Christmas.
Merry
On
Christmas
that,
to all.
thank you.